but a partner is somebody that is there side by side for the woman they love as she's battling breast cancer and helping her to navigate the crisis. And our awareness ribbon is pink and blue, that symbolizes that this is a partnership in survival. We must face this battle together as a man and a woman. Well, in most families, the mother is the rock and the foundation, as my mother continues to be in ours. And when she was diagnosed, I was 29 years old. I was supposedly a grown man. And I immediately thought, oh my God, my mommy's going to die. So I used the word mommy on purpose because I immediately felt helpless, hopeless, and that I couldn't do anything to help. And I think most men, that's what they feel, and the fear is that the woman they love is going to die. And then at that point, we need to step up and be there for them. Well, I think as a son, and that's the perspective I can speak to the most, I don't know what it's like to be a husband of a breast cancer survivor. I know what it's like to be a son. And I know from my perspective and my brother's perspective, it was our time to give back to my mom. She was always there for us. No one in my family raised their hand and say, oh, gee, mom's got breast cancer, what can we do? It was, what do you want us to do? When do you want us to do it? And be there. And that's the way, I don't pat myself on the back, but that's the way my mom and dad brought us up. There's nothing more important than family, and there's nothing more important than being there. And that's really what our mission is all about, is being there. Well, in terms of preparation, there is no blueprint, no playbook for anybody to become a caregiver. Again, somebody's not going to raise their hand and say, can I have breast cancer? So there's no playbook. So from a couple's perspective, which is really what we focus on at Men Against Breast Cancer with our Partners in Survival workshop, it's how do we do that together? And that experience of working on that journey together brings you closer. But you have to face fears, you have to face things you're afraid of, and step up and be there. You know, one of the remarks I use, Helen Keller said, it's better to walk in the dark with a friend than walk alone in the light. And really, it's a walk in the journey that starts in the darkness, and that person that's dealing with breast cancer needs somebody with them side by side, and together you can figure out what to do that's best for your family, because what worked for me is not going to work for you. The first tip I will say, there is no such thing as a top 10 list, because people ask me that constantly. Well, what's the top 10 things my husband, my son, my caregiver can do to let me know that he's going to be there for me? Or conversely, people will ask me in a healthcare surrounding. I said, there is no top 10 list. If anybody tells you, here's a top 10 list, you should run from them, because it does not exist. What does exist, again, in my opinion, my perspective, is in real estate you hear location, location, location. The person who's battling breast cancer needs to know you love her, you love her, you love her. You're going to be there with her every step of the way. Once that is established, you fill that list in together, what works for you as a couple. I think the most effective way, again, from our perspective, what we've learned from our workshops and from other men and women who have battled breast cancer, what works the best is, obviously, I cannot say to you, if you were a survivor, I know how you feel, unless I was a cancer survivor myself. You may mean well by saying it. I can't go to my mom and say, I know what it's like to be a breast cancer survivor or a cancer survivor. I don't. What I can say is, I'm here for you. Whatever you need me to do, let me know, and I'll do it. And just offering that easy statement, not easy, but statement that says, I'm here. What do you need? People sometimes aren't sure what to say, and they'll try to take one word and turn it into a dissertation, a long sentence, no, just say, I'm here for you. What do you need from me? And how do you feel? What can I do to make you feel better? How am I doing as a caregiver? These questions are difficult and challenging to ask in the best of situations, but they've become more difficult when you're facing a daunting, life-threatening disease like breast cancer, and it's hard. It's not easy. That's why communication is so important, the most important thing, in my opinion. The one thing we talk about with the men and the women in our workshops, because the question is, what do women really want from us? We don't know. How do we find out? We ask. But they do want patients, but I can tell you that it's the hardest thing I talk about in the workshops, and if I'm talking to an interviewer about what does a woman really want the most, and this is the feedback we've gotten, is a woman wants the acknowledgement from the man in her life that they are afraid that she may not make it, that she may die from this. Because if you acknowledge that fear, you can't be any closer, because that's the deepest fear. And that is the fear that every person hears when they hear cancer. They still equate it to death. Now, I'm not sitting up here saying, well, gee, I haven't done that with my wife or my mom. I'm a horrible caregiver. No, I'm not saying that at all. I'm just saying if you think about it and you're able to express it because they will appreciate it. And what I will say to anybody that's a caregiver, if you have not acknowledged that fear to yourself at least, you need to look in the mirror, because it's there, and you need to own it, because it's something that we all think of, and it's natural. As a couple, you sit down and talk about it at a time in which it's appropriate for you as a couple to talk about. So in other words, if you and I would say we're having coffee in the morning and that's the way we can have our best conversations, that's when you do it. And you can start off the conversation from the guy's perspective and say, look, I'm afraid, I'm not sure how to best approach this subject with you. What can I do to help you stay motivated? Instead of pointing the finger at somebody and saying, oh, you need to be more motivated, you need to do this, you need to do that. Well, that doesn't work in a normal situation with somebody telling you what you need to do. But if you're talking about how you're feeling about it, and if you're uncertain how to do that, that way that opens a conversation. Now, I'm not saying that's going to make her more motivated, but I'm saying it's going to make her feel more connected to you, because she's going to know that you care about her, and you can't put yourself in her shoes unless you've been in her shoes as a patient with what she's going through. And that's a really hard thing to do, because, the other part of that equation to me is people will say, well, I go to my friend and say, well, I know how you feel. I said, no, you don't. You may mean well by saying that, but it's not something you understand unless you've walked a mile in her shoes, and we have to put ourselves in their shoes all the time. We don't have the remote control from a guy's perspective, and honestly, we never did have the remote control. We need to understand that, and we need to put the remote control in the hands of the person that needs to have it at that point. Well, first and foremost, with anything in life, unless you're there for yourself, it's hard to be the best caregiver you can be. So what we'll talk about, again, a lot of these are general, and I'm not saying it's easy to do. It's not easy, but it has to be worked on, and it's incremental steps. But let's say you're a golfer, a guy. Let's say you play golf every Saturday with the same group of guys, but your wife's in the middle of chemo, home with drains in, and you know you can't play golf. Well, maybe you go hit a bucket of balls. Maybe you play 9 holes once a month. But you do that and make sure that your wife is taken care of before you run out of the house and go leave her there. Or maybe you watch golf on TV and try to set up like a little golf outing to do that from that perspective. However, again, a lot of guys will be surprised if they go sit down and they're feeling neglected. Well, I can't get out and play golf. I can't go work out. Can't work on the car. Can't get out in the yard. Things of that nature. If they sit down and talk to their wife, and predominantly we're talking about husbands and wives, she's going to tell him, go do it. I need some space too. And both are afraid to talk about it. And the guy keeps it inside, and he gets a little angry that he feels like he's not doing what he needs to. And sometimes the woman thinks, well, he knows that I know it's okay for him to go play golf. Well, no, he doesn't. So people need to communicate. It's a two-way street. But the guys will be surprised that as long as it's appropriate where she is with treatment, she'll encourage him, in some cases strongly encourage him to go do what he needs to do at a rate in which is appropriate for their treatment. The Partners in Survival workshop that we developed at Men Against Breast Cancer was born out of a grant we got from the CDC from 2003 to 2008, which was the first grant the CDC ever gave to a men's organization to fight breast cancer. So we were able to pilot test the workshop Partners in Survival. The initial target audience was African American, Hispanic, and low-income populations that have health disparities across the country. But as we came to find out, all men are underserved. It doesn't matter what color you are, it doesn't matter who you pray to, it doesn't matter where you live, what's in your pocket. all men feel that helplessness and hopelessness that we were talking about earlier. So the workshop expanded to reach out to all guys, which is very important. In terms of on a local level, I mean, we've had this workshops in 37 states in Canada, but almost every hospital that I've been fortunate enough to work with across the country has great programs such as yours, has great programs at the hospitals with social workers and people that you can reach out to that it can help you through the process. Go, and we tell people, go talk to your clergy. You can go by yourself, you can go together. You can go by yourself and go together, but reach out for help. And what a lot of guys need to hear is, if they're playing basketball on the weekend and they fall and fracture their ankle, they're going to the hospital, they're getting an x-ray, they're going to the orthopedist, they're getting their ankle set. In other words, they're going to get help. If you're struggling emotionally, it's okay to reach out to any number of those people to help you, because you have to keep in mind, again, a goal, how can I help the quality of her life? And that's taking care of yourself emotionally as well. I think people intuitively know you need to eat right, you need to limit what you drink, smoke, things along those lines, but then how do you actually put that into real life? And it's hard. And it's also part of a discipline that you can teach yourself. And for the times when you fall off the rails and maybe go have a couple slices of pizza and a couple of beers or something lathered with butter, it's okay. Don't beat yourself up. You need to be able to do some things in moderation. But by and large, you're right, you need to focus on those things. And I think the better you eat, the better you're going to feel. The better you feel, the better equipped you're going to be the caregiver for the person you love. But it's okay to fall off the wagon every now and then and not beat yourself up. They could go to menagainstbreastcancer.org, and they can always email us directly at info@menagainstbreastcancer.org, and we'll get right back in touch. And again, thanks for having me, and thanks for all the great work you're doing.